Welcome to the webinar. My name is Robin Glock. I'm a health coach and registered nurse with Orthus Health. I am pleased to be offering this month's webinar, which is Don't Wait, Vaccinate. So our immune systems can weaken with age. So you need immunizations, and that need doesn't end when you become an adult. Immunity from childhood vaccinations can wear off, and you may be at risk for new and different diseases. Also, vaccines and their recommendations may change over the years, and certain vaccines may not be available when you were a child. It's also very important to make sure your adult immunizations are up to date if you are pregnant or planning to become pregnant. Throughout your adult life, you will need immunizations. One of the most commonly heard of is the flu vaccine. Flu vaccine causes antibodies to develop in your body about 2 weeks after vaccination. These antibodies provide protection against infection with the viruses that are in the vaccine. The seasonal flu vaccine protects against influenza viruses that research indicates will be the most common during the upcoming season. It is better to be vaccinated in the early fall before flu season is in full swing. Flu season can begin as early as October and can end as late as May. The CDC feels it's important to convey the full burden of seasonal flu to the public. The flu is a serious disease that causes illness, hospitalizations, and deaths every year in the United States. The recommendation is anyone over 6 months of age get a flu vaccine each season. Next, we're going to talk a little bit about tetanus, diphtheria, and pertussis, which is also known as whooping cough. The vaccine is needed for adults who have not previously received a Tdap vaccine, and the CDC does recommend a whooping cough vaccination for all babies and children, preteens and teens, and pregnant women. Adults should get 1 dose of tetanus and diphtheria, which is the TD vaccine, every 10 years. Tetanus, diphtheria, and pertussis are very serious diseases, and the Tdap vaccine can protect us from those diseases. Tetanus or lockjaw is rare in the United States today, but it can cause painful muscle tightening and stiffness all over the body. Diphtheria is also rare in the United States. It causes a thick coating to form in the back of the throat, which can lead to breathing problems, heart failure, paralysis, and death. Pertussis or whooping cough causes severe coughing spells, which can lead to trouble breathing, vomiting, difficulty sleeping, and then major complications are pneumonia and death. Diphtheria and pertussis are spread from person to person from coughing or sneezing. Those secretions is where that's transmitted. Tetanus enters your body through scratches, cuts, and open wounds. Since vaccinations began, the tetanus and diphtheria rates dropped to 99%, and pertussis dropped 80% in the United States. And again, the Tdap is usually given at age 11 or 12 as a follow-up, and then should be given to anybody who's not received it as soon as possible. A tetanus booster is every 10 years. Shingles vaccination is the only way to protect against shingles and the post-herpetic neuralgia, which is the most common complication from shingles. So the CDC is recommending that healthy adults age 50 and older get 2 doses of the vaccine, commonly known as the Shingrix, and those doses are separated by 2 to 6 months. And this is to help prevent shingles and the complications. So it is shingles is a reactivation of the chickenpox virus. So if you've had chickenpox, you can get shingles. It's also known as herpes zoster, and about 1 million shingles cases occur in the United States every year. Getting the vaccine is shown to reduce your risk by 90% in clinical trials. So shingles being a viral infection, it can cause a painful rash, and that rash usually occurs on one side of the face or body. You may feel pain, tingling, itching sensation where the rash develops, and then that virus can actually cause nerve pain that can last for months or years. Worsening in rare cases, you can develop shingles in your eyes, which can then lead to vision loss. When you do receive the vaccine, the most common side effects are pain, redness, and swelling at the injection site. Next vaccination that we'll talk about is the pneumococcal vaccine. There are 2 different vaccinations available to you, and then that is recommended for adults 65 years and older, or for adults that are from the age of 19 to 64 who have high-risk conditions. Those high-risk conditions are chronic illnesses such as chronic heart conditions, liver, kidney or lung conditions such as emphysema or asthma, diabetes, and then alcoholism. Conditions that are at high risk would also be things that weaken the immune system like HIV or AIDS, cancer, or a damaged or absent spleen. High risk are those also with a cochlear implant or cerebral spinal fluid leaks, and also those who smoke cigarettes. The transmission of the pneumococcal bacteria is spread person to person by direct contact with respiratory secretions like saliva or mucus. The bacteria can cause the Streptococcus pneumoniae, which is the pneumonia, but also can lead to ear infections, sinus infections, meningitis, and then bacteremia, which is a bloodstream infection. So the most common ways you're going to spread that is through coughing, sneezing, and then close contact with an infected person. Check with your healthcare provider to discuss which of the vaccines is right for you. There are 2 different types available. And the recommendation from the CDC for the vaccination is all children younger than 2 on all adults that are age 65 or older. And then as we discussed, those age range from the age of 2 to 64 with the higher risk conditions. And the hepatitis B vaccine. Hepatitis B is a liver infection caused by the hepatitis B virus. It's transmitted through blood or other body fluids from a person that is infected with the hepatitis B virus to someone who is not. And this can happen through sharing of needles, sexual contact, and from mother to baby at birth. For some people, the hepatitis B is an acute or very short-term illness, but for others, it can become long-term and chronic infection, and that risk for infection is related to age at time of infection. So approximately 90% of infected infants become chronically infected compared to 2 to 6% of adults. Chronic hepatitis B can lead to serious health issues like cirrhosis of the liver and liver cancer. The best way to prevent hepatitis B is to get vaccinated. So why should people with diabetes get vaccinated? The big thing that we've discovered through the CDC has discovered is that people who have type 1 or type 2 diabetes have higher rates of hepatitis B than the general population. Some of the cases have occurred in individuals with diabetes whose equipment came in contact with infected blood or who had contact with the virus through breaks in their skin. This happened through either improper reuse or sharing of glucose monitoring equipment or other diabetes care equipment. And the big finding was that transmission occurred among people with diabetes who reside in assisted living facilities when several people are receiving glucose testing in a closed area. So now the recommendation is that hepatitis B vaccine be given to all adults with diabetes. What it does is the vaccine stimulates your natural immune system to protect against the virus. It's made from parts of the hepatitis B virus. It cannot cause hepatitis B infection, and it's usually given as 3 or 4 shots over a 6-month period. Infants should get their first dose of hepatitis B at birth and will complete the series at 6 months of age. All children and adolescents younger than 19 who've not yet gotten the vaccine should be vaccinated. And it's recommended for anybody that would be at high risk for hepatitis B contraction, which would be those who have sexual partners with hepatitis B, anybody who is sharing needles or syringes, people who are being evaluated or treated for another sexually transmitted disease, anybody that's in close contact with somebody in the household that's infected with the virus, healthcare and public safety workers who are at risk for exposure to blood and body fluids, residents and staff of facilities for developmentally disabled persons, or if you're working in a correctional facility, nursing home, or personal care home, and then if you're traveling to a region with increased rates of hepatitis B, and anyone who really just wants to be protected from the virus. So it's important to remember serious diseases are still out there. Vaccines are a safe and proven choice. The CDC reports that vaccine side effects are usually mild and do go away on their own, and severe side effects are very rare. So it's important to talk with your healthcare provider and make an informed decision about what vaccines are right for you. And as always, if you need any additional support, please feel free to contact your health coach. We are here to help support you on your healthy journey. Thank you for joining me for this month's webinar. Have a great day.